Let's talk about vitamin D. There are 3 points I'd like for you to take away from the next few minutes. One, how vitamin D is made in the body and its most beneficial form. Two, what are some of the functions it plays in the body. And lastly, number 3, its optimal levels in the blood. Vitamin D actually refers to several different fat-soluble vitamin forms, all of which are known as sterol substances, which are actually cholesterol-like substances. There's no other vitamin in the body that requires the collaboration of so many different organ systems in the body in its making. These organs include the skin, liver, kidneys, the blood itself, all of which are required in the formation of its active form, which ultimately has an effect on the body. Most of you have probably heard that vitamin D is also known as the sunshine vitamin because it actually is manufactured in our skin once the UV light hits our skin. It's important to remember that wintertime, clouds, pollution, and dark pigmented skin all reduce the production of this vitamin. As I just mentioned, the process by which the vitamin is made in the body takes place in several stages. Once the UV light hits our skin, it interacts with a form of cholesterol, which is then transported to the kidneys or the liver to be converted to a form of vitamin D known as vitamin D2. This, however, is not the most active form of the vitamin. The most active form of the vitamin is actually known as D3. However, D2 is the most commonly prescribed form of vitamin D by many physicians or is added to many supplements or vitamins. However, vitamin D2 still needs to be converted by the body, even if it is ingested, into an active form. And so the effect that the vitamin D form that has an effect on the body is D3, as I just mentioned. And D2 is generally transported to the kidneys in order for its full conversion. Because vitamin D3 is the most active form, it is the most desirable supplementation form. Vitamin D plays many roles in the body, important roles. It helps, for instance, it helps with the regulation of calcium metabolism and the normal calcification of the bones. Vitamin D3 is what helps increase the absorption of calcium from the digestive tract and also decreases the elimination of calcium from the kidneys. So even with adequate intake of calcium, if our vitamin D intake is low, the outcome is that we have poor calcification of our bones, as an example. It's important to remember that because oftentimes physicians prescribe straight calcium without any vitamin D, it is not likely to do much unless people are constantly bathing in the sun. And given the fact that as a culture we no longer spend any time outside, that is an issue. So taking calcium along with vitamin D and magnesium, which is one of the most important cofactors for vitamin D, altogether, those three are more of an ideal combination for best bone health. Vitamin D also participates in the maintenance of the nervous system, the proper function of the heart, the blood, the immune system, and so on. As you can see, plays a tremendous role in the body. Lastly, in the last number of years, there have been hundreds, if not thousands, of studies that have shown that vitamin D deficiency is on the rise. Again, the clouds, the pollution, dark pigmented skin, lack of being outside, and even when we are outside, we're lathered in sunscreen head to toe. Of course, other causes like liver disease, kidney diseases are all contributing to this rise in vitamin D deficiency. The other very important consideration is the levels that are considered normal are not necessarily optimal. Many labs will often have different ranges. A common range to see is between 30 and 100 nanograms per milliliter. So if you're at 33, does this mean that you have sufficient levels of vitamin D? The answer is no, because there's a difference between normal and optimal. There have been many studies that have shown that for proper health, at minimum, people's levels, and that includes children and adults both, the levels should be at about 50 nanograms per milliliter, with optimal levels between 50 and 80 nanograms per milliliter. Do you know your levels of vitamin D? I highly encourage you, next time you see your physician, to have your levels checked.